Our loving Heavenly Father, thank you so much for continually caring about us. Father, we pray that we'll learn something today that will be applicable to our everyday life. We love you and praise you in the name of Jesus Christ. Amen. Okay, so how many of you know that you have a chemical factory inside your body? And it's also a detoxification station. Okay? It looks like this. Maybe. Okay? Now, it's running neck and neck with the brain, but it's the largest internal organ in your body. It's actually a little bit bigger than the brain. Of course, some people have bigger brains, I'm just kidding. Yeah, my brain gets awful active. I'm just kidding. It depends on what's going on, and we're going to talk a little bit about that. But if you feel a pain that's kind of underneath your ribs, a lot of times that's kind of your gallbladder type of deal. Okay, but here's your liver. If we take a close up of it, it looks like this. Okay, so here's your liver. What's this piece right here? That's your gallbladder. And then it comes down here, and you see that you can almost, this big arch here, what is that? That's your stomach. What's behind your stomach? Can you see this feather-looking thing? That's your pancreas, right? Well, the pancreas has a tube that comes down this way, and this comes down this way, and they meet in the intestine. It actually comes over here and meets in the intestine over here, okay? You can kind of see, no, that's the kidney. Sorry, it comes down here and meets in the intestine, and that's called the common bile duct, okay? Because you have fluids coming from the pancreas, which is sodium bicarbonate and enzymes and things like that, and then you have bile coming from the liver down into the intestine to emulsify fat, okay? So you have all this activity here. If you feel that pain underneath your rib cage on the right-hand side, sometimes it's because a small little stone has gotten down here and it starts to obstruct it, okay? And so if it obstructs both of them, then it can cause some different kinds of pain. One can be right underneath where your rib cage kind of comes together, or the other one can be over underneath your rib cage over here, okay? That would be from this. Now, a gallbladder attack can feel a lot like a heart attack, only on the opposite side of your body. Okay? So the symptoms of a heart attack would be that you would have left-sided chest pain, left-sided pain underneath your ribs. It can go up into your neck and your jaw. It can also go down your left arm. Okay? Only if your heart is flipped around backwards. There are a few people who have their hearts flipped around backwards. Okay, it's a medical condition. They are the negative of what we are. So instead of their heart being on the left side predominantly, it actually is on the right side predominantly. Okay, so they would feel a heart attack on the right side. If you feel left jaw pain, neck pain, arm pain down your right arm, all of that, then if you feel chest pain, or it feels like somebody stuck you straight through with a spear coming out the back, that's gallbladder or liver. Okay? So if you feel it on the right, it's typically gallbladder or liver. If you feel it on the left, go to the hospital. Or put some cayenne pepper in your mouth and see how you're doing. Does that make sense? Okay. So what is the functional purpose of the liver? The liver is responsible for about 200 different functions in the body. Okay? I read an article here recently, and it said one of the biggest reasons that they're having trouble making an artificial liver is all these functions. Can you imagine making a plant that's small enough to go in your body that would do all of this? Okay? Nearly impossible. Okay? I mean, God did it, but, and it only took him one day, right? The largest we kind of did this. This is about 3 pounds. Okay. Most people are unaware of how vital it is for good health. Some of the major functions of the body are. Oh, you know what? I moved that slide and didn't remember to take the. It's so important that if your liver was to fail, within 24 hours you'd be dead. Okay. So we can't live very long without a liver. A lot of babies, their liver isn't completely mature, so when they come out of the hospital, what happens? They turn yellow. Why is that? It's called jaundice, right? Jaundice is really a buildup of bilirubin, okay, which is a portion of red blood cells that isn't being detoxified, recycled, and reused. Okay, so it builds up in your body. Yeah.
Is that common? Because my daughter had jaundice when she was in the hospital too, and I hear other people's kids had that.
Yes, it's not too awful uncommon because we may not take great care of ourselves when we're having a baby or what have you, or the baby is taken early, so the liver isn't quite ready. The mother might have liver problems, and so she borrows part of the baby's liver while they're together. And so, see, how many of you have ever heard a pregnant woman say, while I was pregnant, it was the best time of my life? It's because the baby supplies a lot of new organ functions. And if the mother is deficient in those, she can use those organs for her own advantage. So the baby comes out, and he's going, I don't feel so good. Mom used my liver. You see what I'm saying? So it's not uncommon for babies to have jaundice. Now, one of the best things you can do for jaundice is ultraviolet light, sunlight. Okay? Yes.
Just a quick statement. If you have a comment or whatnot, so we can make sure that it gets on the video, would you please raise your hand like Tim did, and so that we can get to you and be able to allow you to really ask the question in a way not only the video will hear, but the rest of us too.
Okay. You know how the heart pumps several quarts per minute? Well, all of those quarts that come through, we're looking at 1.4 liters per minute of blood purified. So see, it's going to pump it through our liver as fast as it's pumping it out of the heart. It regulates our metabolism, adjusts fats, proteins, carbohydrates. It stores minerals, fats, soluble vitamins, protein synthesis. When you take something into your mouth that has protein in it, the very first thing your body does is break it apart. Okay, it breaks it down into amino acids. And then what it's going to do is the liver is going to start putting it back together depending on what your needs are for those proteins. Okay? Glycogen storage, which when you eat a carbohydrate, it turns to sugar in your body. That's what you're supposed to use for fuel. That is it's called glucose. And so when we ingest glucose, it breaks it down. And then if we don't use it, it turns it into a storage form called glycogen. Okay? The liver will store some of this. It'll put some of it into fat cells so that it can convert it later. Okay? Cholesterol production. Remember a couple of weeks ago when we were talking about cholesterol, I said that you could only control the amount of cholesterol that you take in by 20%. If you cut out all cholesterol foods, then the only thing that your body will make the amount of cholesterol it needs, which is 80% of what's in your body. Okay. Contrary to a lot of Western medicine where they say, you got to get your cholesterol down, you got to get your cholesterol down. We use cholesterol as a precursor for steroid hormones. It also is a manager for brain function, nerve function, and hormone transportation. So we can't get rid of cholesterol. Did I see a hand?
I was wondering about the steroid part hormones. What do you mean by that?
All of your reproductive hormones are steroid. And then many of your other hormones in your body, whether it is something like your thyroxine and like that, those are all hormone steroids.
Okay, if you're on a steroid yourself.
You're supplying that from the outside in. Okay?
So that's not going to do any extra damage?
Well,
If
not,
it's on a
I
low
mean,
dose.
it, you know, it depends on what you're on and why you're on it and things like that. And so it's hard to tell, okay, why are you on this? I mean, if you took out your thyroid, you would need a hormone replacement therapy of some sort because you can't utilize the thyroxine that's coming down from your pituitary gland and like that. It's got to be supplied for someplace else. So you have to have these regardless of whether they come from an inside or an outside source. Now, that doesn't mean that all steroids, external steroids, are good. Okay? All medications are toxins with a beneficial result. Okay? So let's say you've got high blood pressure that's through the roof. Well, if you don't get it down, you might have a stroke. So getting it down may be a priority, but it's a lifestyle issue. So should we continue to take the medication, until we pass away? No, we should try to work on it with our lifestyle so that it gets it down so that we don't have to take the medication. Okay? Yeah.
Yes, I have a question here. Parathyroids. Understand that there are like 4 little flaps.
Yes, 4 little dots on your thyroid.
Right. If you lose like 3 of them, what are the chances of survival and long?
Most of what the parathyroid does is regulate your immune system, and you can do that on one.
Oh, really?
Yeah.
But
The body is great with its redundant processes.
Okay. All right. Yeah, I have a friend that have that. I'll be short, and she's just terribly tired all the time.
Well, and she may need something to boost her parathyroid or even her thyroid function.
But she could live on one. What
Yes.
if all 4 were gone?
All 4 of them, she'll have to have a replacement. She'll have to have some sort of replacement hormone therapy.
And they can do that?
Yes.
Oh, great.
Yeah.
All right. Thank you.
Speaking about the cholesterol, a lot of Western doctors want your cholesterol down around, what is it, 120 or 200?
It's usually below 200, somewhere around
Yeah.
160 to 180.
I've heard a doctor say that he wants it right around 300. And the reason is just what you were saying. It has all these extra effects. So when you hear those cholesterol numbers, if your bad cholesterol is up, that's a sign that you're using it. Not that it's bad, but you're using it, and you may have to do something to change what is going on so you stop using it quite so much.
Okay, so in your statement, there were a couple things that I want to point out. Number one, we shouldn't have extremely high cholesterol. But by the same token, we don't want extremely low cholesterol. It depends on what your body's doing with that cholesterol as opposed to, whether you should have high or low or even the sources of that cholesterol. So cholesterol isn't neither good or bad, but it's produced because of what you do, whether you put it in your mouth or whether your body makes it. So, we want to make sure that we have cholesterol. There was somebody that had their cholesterol down to, 50 or 60, and I'm going, that's a little too low. We should probably try to get that up. And, of course, what's the quickest way to get it up? Eat something with cholesterol in it, right? So, we want to have a good quality cholesterol to boost that, or, eat something that the body is going to cause it to create more cholesterol. Okay, most of us don't have that problem. We don't have low cholesterol.
So how do we know how much do we have?
Blood test.
Oh, they'll find out on the
As a
blood.
matter of fact, almost all standard medical medical fairs, where you come in, health fairs and like that, they'll almost always check cholesterol, blood
Oh, well,
sugar,
that's good
things
then.
like that. I mean, because it's a real easy test. They've got them down to where it's almost nothing. They can stick your finger and figure it out. So it's not difficult. It protects your body from parasites, and this is probably one of the biggest factors, is it detoxifies your body. Okay, so if your body is toxic, then we need to get your liver under control. Hepatocyte. How many of you have heard of the liver being called? You've heard of hepatitis. That's inflammation of the liver. So a hepatocyte is a liver cell. Okay, they're responsible for making much of the proteins of the body and are required for protein synthesis, including blood clotting factor, albumin. Albumin is the if you've ever had your blood drawn and they separate it, now you have a yellowish clear liquid and a thick blood red stuff. The yellow clear liquid is albumin. It is the most abundant protein in your body. Okay. It requires to maintain fluids within the circulatory system because that's the albumin. The liver is also responsible for manufacturing cholesterol and triglycerides. It is responsible for turning glucose, remember the energy source, into glycogen and stored both in the liver and in muscle cells, also stored in fat cells. The liver makes bile to help with digestion. The bile digests fat. Okay? The bile is a lot like dish soap. Have you ever had a greasy pan and you pour a drop of dish soap in it? What happens to it breaks it down. Okay? Bile breaks down the fat. It's able to store vitamins and chemicals as building blocks, including B12, folic acid, iron for making red blood, vitamin A for vision, vitamin D for calcium absorption and other things, immune modulation, vitamin K for helping to clot blood. Okay? The liver plays an important role in detoxifying the body, converting ammonia, a byproduct of metabolism in the body, into urea, excreting in the urine by the kidneys. Yes.
I got a question for vitamin K.
Yep.
I heard that it can cause, if you're having surgery, you're not supposed to have vitamin K because it'll make your blood too watery or something like that.
It actually will do the opposite. It'll cause it to clot more.
Well, that's what it meant, yeah.
Yeah, it won't be too watery. It'll cause it to clot more. As a matter of fact, vitamin K is actually the antidote if they give you warfarin or heparin or a blood thinner. Vitamin K will actually be the one that they would give you in order to thicken your blood again. Okay?
Okay. So also, so when you have surgery, you got to make sure you don't get too much of that then?
Well, yeah. Most people aren't on a prophylactic dose of vitamin K. That's not something we would typically have as a supplement around the house.
But if it's a multivitamin, it has some in it.
Yeah, it's usually a microgram or something like that. It's a very small dose.
Oh, okay.
We have treated animals who have gotten into rat poisoning and like that because rat poisoning is really it's a blood thinner, and so the rat will eat it and it'll be too much for his body and he'll just bleed out. Well, we've had animals, dogs and rabbits and things like that got into that poison, and so the treatment is vitamin K.
Now, is this treatment that you got on here, is that going to help the hepatitis A and B and C and stuff like that?
It would probably go. If I were rather than this protocol here, it would be a more specific. This is for specific general health, and
Maybe
you'll see some of the things that why you would do this a little later. Okay. The liver also breaks down medications, drugs, including alcohol, and the response breaking down insulin and other hormones in the body. See, our body recycles as much as possible. When you have a red blood cell, there are many different parts of that red blood cell. And your body, when it is getting ready to die, it'll go through the spleen, and the spleen will dismember that blood cell, send all the parts back to where they need to go so that you can reuse it. It'll remake another red blood cell. So our body is tremendously efficient at reusing its resources. Okay? This isn't, you know, I've talked to people who I said, well, you know, we're exposed to toxins every day. And they say, well, you know, not me. I have a vegan lifestyle. I'm not exposed to any toxins. I'm very, you know, nothing. I'm so clean, I squeak. According to the Environmental Working Group, studies show that the average American is daily exposed to 200 chemical toxins and carries as many as 91 of them with them each day. Okay? The interesting thing is they did a study probably about 10 years ago, and they followed women from gestation, the time that they conceived that baby, clear to the time that they delivered that baby, and that the mother and the amount of toxins that were in that mother and like that. And then they tested the baby right after it was born. So that when it was born, they drew its blood, and they found out that it had 141 toxins in it at the moment of birth. Okay? So, you know, we don't necessarily get away from this toxic environment, you know, even when we're being born. Okay, so where do we get a lot of these toxins? Non-organic food, okay? Lead, mercury, PVCs, and over 130 other pesticides, okay? These are non-organic foods. Air pollution, tap water, fluoride, chlorine, PCBs, mercury, lead, parasites, skin care products. I was looking for a specific one here, but not only skincare products, but household cleaners and products. You know, there's a lot of these things that go under our sink that, you know, just the fumes and like that could cause us some toxins. Medications, both recreational, prescription, including common used ones like corticosteroids. See, this can cause a toxin too. Tetracyclines and aspirin. Plastics have an off-gas effect. You know that new car smell? That's actually toxic. Okay, it's new plastics and like that are off-gassing in your car. Yeah.
Can we? Is this in our notes somewhere?
This is not in your notes.
Okay, probably be helpful.
Okay. Can I borrow your pen? I'm just kidding. I could probably. If you want a copy of this, just send me an email and I'll send you this whole PowerPoint. Okay. Yes.
Just real quick, I was wondering, what are parabens? It was just...
Parabens is a polymer from petroleum.
Okay.
It's like plastics or like that.
That's in a lot of hair products and stuff like that.
Yes.
Okay, thank you.
Yes. You know, even in a lot, and cookware like nonstick pans. You know, Teflon is not something we should be ingesting. How many of you have ever seen a Teflon pan that had a scratch in it? Where'd that stuff that was inside the scratch go? That's right. We ate that with the rest of the food, right? Okay. The safest cookware are going to be glass, earthware, or stainless steel. Those are the safest because they don't interact with your food. Stress. You know that we create chemicals that cause toxins inside our body when we get all stressed out. Okay. Alcohol, caffeine, cosmetics. One of the most damaging things that we can do to our liver is putting on fingernail polish. I know because I do this. Put on fingernail polish. Now, that's not the damaging thing. How do you take off fingernail polish? Acetone. You know, acetone is absorbed right into your skin and is taken right to the liver. It's one of the most damaging things you can do. Okay? Yeah. a fingernail file. We'll just sand them down. Okay? Personal hygiene products. Almost, unless you're cautious, almost all your personal hygiene products have aluminum in them. They have an anti-caking agent or something like that in them. And so you want to be very careful because you're absorbing that aluminum right into your body, especially if you put it underneath your arm where your lymph nodes are, things like that. You spray on a cologne or something like that. These things can be toxic. Okay, so you want to be aware of what you're putting on your skin. A favorite herbalist of mine, he said, if you can't put it in your mouth, you shouldn't put it on your skin. Okay? How many of you want to eat your deodorant? I mean, it should be that way. You shouldn't put something that you can't put in your mouth on your skin because your skin's going to absorb it. Right? People thought for several years that transdermal wasn't possible. Well, anything you put on your skin is going to be absorbed in. Yeah.
Are there some things that we can use to help our odor?
Well,
Armpit
yes.
Odor that
Number
is
one,
natural?
let's consider where the odor's coming from. We know that one of the biggest detoxification organs besides the liver is your skin, right? So you're trying to get stuff out from your body. So the best way to control your body odor is by not putting stuff in that is going to toxify you because your body's really trying to get stuff out.
And
Okay.
how are we going to, we need to have a list of those things that are going to put those things. I mean, we are done. I
Okay.
tell you, what they have done
Okay.
to us is just horrible.
So then there are other things that you can do, especially if you want let's say that you've controlled your body, your meals, the stuff that you put in it, as best you can. Now, what is a good way to cover up if there is any residual odor? Okay? You might use essential oils. Essential oils, oils from like flowers or things like that, something that has a smell, a lavender oil or something like that, to kind of give you, I mean, if you put on a deodorant, it kind of has an herbal smell or a baking powder smell or something like that, right? And really, you don't care what it is as long as it doesn't, as long as when you give somebody a hug, they're not going. Yeah. That's true.
Perhaps what we're also seeing is a shift in our culture, that as we have asked our quote-unquote food to have a shelf life, so we have also asked our bodies to, the way we feel about smell, about scents, to have a shelf life, rather than maybe changing clothes, or how that things were done before. It was accepted that if you work hard and sweat, there's going to be some odor until you get a chance to rinse.
Right. He said garlic. They won't notice your body odor. I was listening, now don't hold this against me, it was a long, long time ago. I was listening to Richard Pryor, and Richard Pryor said that he went over to Africa and he got into a Jeep with a driver. And the first thing that he noticed was that this driver smelled awful. Well, it wasn't very far down the road, and the driver stopped, and he says, you know what, you've got to get out and wait for the next driver. I can't stand the way you smell. And so that's kind of what Susan was talking about, The fact is that, we're used to those nice smells and things like that. Go ahead, right here.
I work in a clinic, and I had a gentleman who came in. He was a man, maybe in his 70s. His insurance company told him he had to go on a diet, and they gave him a life coach.
Okay.
Talked to the life coach, and he said, I want you to go vegan. I want you to get off all animal byproducts. And the guy said, well, okay, because, of course, it was a financial benefit to him to do that, and he needed to lose the weight, bring his blood pressure down. He said that not only did he do all of that, at the end of the diet term, the coach said, well, okay, you can start eating meat again. And the man said, why in the world would I want to do that? I feel better than I have my whole life. And he said, it's interesting to note, since he has gone completely vegan and eats healthy, organic, and natural as God gave it to us, he doesn't have any body odors. He has to only rinse off in the showers. He doesn't have, a problem with needing soaps and things like that.
It's very possible. I mean, we noticed that most of those things go down. Most of those odors go down when we start eating a more holistic lifestyle. Yeah.
What deodorant do you recommend that doesn't have aluminum in it?
You have to look for it, and there are deodorants out there. You won't find it at the regular store, but you will find it at your. Okay. So there are Crystal. I've used Crystal. My personal preference is I don't use a deodorant. I mean,
Baking soda.
baking soda.
Oh, I need to say something because, and there is so much to say about it, but in the old days, people did not care about deodorant or blah, blah, blah. This is smelling good and this powder over here, blah, blah, blah. They got us into it, and now we stuck. In the old days, people did not use those things, and we were used to smell. It was nothing new. It was a natural smell for the human being to smell the way it is. Also, the other thing, people used to walk a lot in the outside. So the fresh air and all that, but it was a normal human smell odor.
That's
you know.
right.
But
That's right.
now they have taught us that we have to smell good.
Okay. So, what are some early signs? Okay.
Several years ago, I met some women from Bermuda at a camp meeting.
Uh-huh.
And somehow or another, we got to talking about deodorant. And they says, a lot of them there in Bermuda do not use deodorant. They
Right.
use fresh lemon.
Yeah.
And so what happens is by putting on all these roll-on, it suppresses the glands.
That's right. Or
So-
absorbs it in.
Right. So I said, okay, I'm going to try this. Well, the first, couple of days, I still had that musty smell. And they said, you just wait. So I've been using just fresh lemon every day.
Yeah.
And I use fresh lemon on my face, which takes away some of the, the little dark things that
Right,
get
right,
on
right.
there. So that's a great way. And just get a fresh lemon and cut it, put it on your hands, just rub it in, and under your arms, you will be really surprised.
You slice.
Right, you squeeze it in your hand.
You slice it in half, and you go like this, and then you can squeeze it in your salad. That's a good idea. I mean, not to squeeze it in your salad,
I
but,
put it on my
but
face too. and
to
then
use fresh
slide
lemon.
them.
No, go ahead.
Oh, she was just asking me how to use it. I said, just squeeze it like a little puddle,
Yeah.
and just rub it in your face, and then put olive oil. And
Okay.
it's wonderful. Clears up a lot. That's just an additional because it's so dry here. So that's really helpful. No, I don't use any makeup, any stuff like that.
Yeah. Okay. So, what are some of the early signs to having liver problems? And a lot of these first ones, hormone imbalance. We're not just talking about women. Okay, we're talking about women and men. Intolerance to hormone replacement therapy, severe menopausal symptoms, and for you men, this is called andropause, not menopause. Okay, it's a decrease in those symptoms that are for men as opposed to women. PMS, estrogen dominance, mood swings. That we all get them. It's not isolated to just women. Okay.
Mark, have you heard of PMDD?
PMDD. Blood sugar problems, sugar craving, hypoglycemia, type 2 diabetes, energy slump, waking in the night. Okay. Well, hypoglycemia is, you remember back a few slides ago when we said that the liver converts glucose into glycogen. Okay, that's the storage form. Well, if your blood sugar starts to go down, the normal response would be to take that glycogen and convert it back into glucose and put it into the blood system. If your liver isn't functioning correctly, what happens is that conversion doesn't take place in the opposite direction. And so your blood sugar continues to go down. That's called hypoglycemia. Okay? So you want to get your liver functioning to where that takes place, that conversion back to glucose. Yeah.
Yeah, I was wondering about the blood sugar, and once you're high on the blood sugar a little bit and you start working down, but can you get dizzy? I mean, what causes being
Any
dizzy?
imbalance in your blood sugar can cause dizziness, passing out, crankiness. I mean, there's all kinds of symptoms to having either too high or too low a blood sugar.
And then with the stress level that a person's in, that can cause it to go make more dizziness.
Right.
Okay.
Yes.
How do we work to get that down, though?
Get the blood sugar down.
Yeah, I don't eat that much sugar.
Well, it's if we're talking about insulin resistant or diabetic or what have you, that getting the blood sugar down is not a problem of the sugar. It's the amount of fat that the person is eating in their diet typically.
Maybe you're not eating enough fat.
No, you're eating too much fat.
I don't eat much fat at all.
It doesn't matter. It's what your body does with it.
Really?
Yeah. If I understand you correctly, we're talking about either too high or too low of blood sugar, and what is happening inside your cell is what's important. And so the blood sugar, if it's staying too high, there's a metabolic problem, and you don't have to be heavy. You don't have to have too much weight. It can be genetic. So you might have a predisposition for not being able to assimilate your blood sugars the way you're supposed to. Okay. So medications can cause a problem. It can also cause a dysfunction in your liver that will cause a problem. Okay. All right. Yes.
I heard that if you eat too much pasta, or if you eat pasta, that it also converts to sugar.
Okay. So the definition of carbohydrate is any plant food is going to have a level of carbohydrate in it. Okay. Now, if we refine, let's say we take a kernel of wheat, or a cup of wheat kernels. All we have to do is grind that, put some water and maybe some other ingredients in there, and we have pasta, right? So if we'd ate the wheat kernels, the body would have taken a long time to get that same carbohydrate out of that wheat kernel. If we eat pasta, it goes in a little quicker because it's already broken down. Okay? So tell me again what your question was. If you eat pasta, it does convert to sugar. So your body is going to convert any carbohydrate into sugar because that's what it burns. It doesn't burn fat, doesn't burn protein, it burns carbohydrates. Well, anything that burns fast is going to be a good sugar. Is going to be a bad sugar. You want it to break down slow, okay? And that's going to be better for you. So a carbohydrate such as pasta will burn faster than a carbohydrate from an apple.
Because I love pasta.
Okay, well, all things in moderation, but,
Right.
I don't see anything wrong with pasta. It's just that you probably shouldn't be living on pasta. You want to have several other things. Yeah, and then have some other fruits and vegetables with it. I think Tad back here.
So it's kind of like when you're talking about eating the corn, and they take and process it and put it into corn oil.
Right.
Now you've ate 27 deals
Exactly.
of corn. Same thing with the pasta. If you want to eat a handful of kernels, that's fine. That will take you a while to get through.
Right.
But if you eat that same amount of pasta and then multiply that a number of times, now you're eating maybe 150 times the amount of kernels you're eating,
Right.
and that's too much.
Right. And the more it's processed, we can take pasta and we can have whole wheat pasta or something like that, as opposed to white pasta, which has been bleached and refined and things like that, that pasta is really not that good for you. The less it's been refined, the better off it is for you. Okay? Immune dysfunctions, allergies, skin rashes. Had a patient up in Sandpoint. Actually, she lived in Bonners Ferry, and she had eczema from her elbows down and from her collar up. Okay, and she came in and she says, "I don't know what to do with this. I've done steroids, I've done creams, I've done this, I've done that. Nothing seems to be working." Had her do a food allergy test, and as long as she stayed off of those foods, she was good. Now, the liver was part of the process. The liver was what was causing some of those hypersensitivities. And so we worked on her liver and got her to where, she was less sensitive to some of those things, okay? Chemical sensitivities, fumes from things, perfumes, chronic fatigue and fibromyalgia. I have treated many, many people with chronic fatigue and fibromyalgia. And the one thing that I know is that chronic fatigue and fibromyalgia is a toxic overload syndrome. Okay? Now, is that the only thing it is? Could you have some autoimmune in there and things like that? All of that may be true, but the easiest way to treat chronic fatigue and fibromyalgia is to get the toxins out. Okay? So, frequent illnesses. Your immune system will drop and you won't be able to resist some of these other illnesses. Nervous system, depression, anger, irritability, foggy brain, overheating, frequent headaches. Okay? Digestive problems, gallstones, intolerance to fat, sensitivity to alcohol or caffeine, acid reflux, bloating and constipation, irritable bowel. External signs, furry tongue, okay? If you have a white-coated tongue or a brown-coated tongue, and you can scrape that off, that's typically because there's some toxins or some overgrowth going on in your body. Let me see your tongue. Bad breath, acne, rosacea. Rosacea is that real, is that color in the cheeks. Okay, people look like they just got slapped across the face. Yellow, red, or itchy eyes. If a person has jaundice and you look at them, they're going to have a yellow tint to them, but they're also going to have the yellow in the eyes. Okay, that's how you can tell if somebody is on a carrot juice fast and they've been doing this for months. And jaundice is that you can look at their eyes. On somebody who's got too much beta carotene in them, they'll have yellow skin, they'll have yellow hands, but their eyes will be white. Okay, if it's jaundice, their eyes will be yellow. Bruising easy, if you bruise yourself easy, it may be because your body's not producing enough clotting factor, things like that. Brown spots, what are they called? Liver spots, right? Skin tags. Okay, if you have skin tags, it's an indication that your liver is toxic. A skin tag is a little flap of skin, usually, less than, say, a millimeter across, and it hangs off. And, a lot of people will have them on their neck or under their arms or things like that. Those are an indication that your liver is toxic. Okay. Abnormal fat, abnormal metabolism of fat. Your body isn't able to break it down and utilize it. So what's it do with it? It stores it, right? So we wind up storing our fat to the point that we have what's called hepatomegaly. Okay, hepatomegaly. We take hepato, which is what? The liver, and we say megaly, which is large, right? An enlarged liver. Okay, and what does this lead to? You see a person who's been drinking all their life. They've got a beer belly and like that. They have hepatomegaly. And the next thing that comes on them is cirrhosis, right? Okay, so extreme damage would be cirrhosis of the liver or permanent scarring, and then the cancer. Now, Max Gerson says that all cancer, no exceptions, all cancer starts in the liver. Okay, why is that? When the liver gets full, it starts to shovel toxins into places. It can't get rid of them effectively, and so what it does is it puts it into places where it tries to store it. Well, if you have a toxic waste dump somewhere in your colon, in your pancreas, in your brain, what's going to happen next? It's a great place to set up an environment for cancer to grow, right? You have an acid condition and a low oxygen condition because of the toxic dump, and now you have cancer. Okay? So the key to dealing with liver problems is education to prevent damage before it happens. How often do you hear about common symptoms such like what we've talked about, with which are associated with the liver fatigue as a result of toxic stress and lifestyle from your doctor? You go in there and your doctor says, you know what? What you need is a good liver cleanse. It's like the guy that Pastor was talking about this morning about washing his hands, you know. Okay, so phase one, the very first phase is we want to get the surface stuff out. This is Mary, do you get email? Okay, all right. This is a liver flush. I didn't print this out for you because it's 6 pages long, and if you have an email, I'll send it to you, okay? If you do not have an email, I have an extra copy because there are some people who don't have emails, and so I wanted to make sure that those people got it. What a liver flush is it is the most superficial cleanse of the liver. And what you do is you start by drinking fresh pressed apple juice for 6 days. You drink a quart of it. Now, we had a situation where a person couldn't do that recently, and they said, I'm allergic to apples. Can I take it in a different way? And so the constituent that we're looking for is not the apple juice. It's malic acid. Malic acid is a relaxer of tissue. That's why we have them drink apple juice. It is only to get the malic acid in. And so I just talked to the allergen company, and they said malic acid isn't a protein. The person is allergic to the protein of the apple, not the malic acid. Okay? And so she was able to take malic acid without having to drink the apples. Okay? Malic acid relaxes tissue. So then what we do is you do that for 6 days. On the afternoon of the 6th day at 2 o'clock, you stop eating. Okay? Then what you do is you prepare yourself 1 quart of water with 4 tablespoons of Epsom salts. It's magnesium sulfate. Guy?
When you drink the apple juice, is that all for 6
Oh,
days?
no. No, you can eat just as you've been eating.
Oh, okay.
Okay, I recommend a high-quality diet.
Uh-huh.
You know, have a high-quality diet, and you just consume the apple juice along with your regular diet.
Okay. Is it okay to drink the apple juice with cranberry? Because I buy the cranberry apple juice.
You're going to press your apples fresh.
Oh! I'm
fresh
gonna make my
apple juice.
own apple juice.
Correct. And it needs to be organic.
What about if I just eat the apples?
No, we need it to be in a sufficient quantity. And to make apple juice, a quart of apple juice, you need about 4 or 5 apples.
I don't
And-
have a way to make apple juice.
The thrift stores, she's got up here, stomp on them. The thrift stores sell little Juice Man Juniors and like that all the time. And they're
They sell what?
Juice Man Juniors. They're a little juicer, and they're you can probably pick one up for $5. You just got to kind of keep your eye open.
Apple juice.
Apple juice, a juicer. Excuse me. Sorry about that. So you're going to take a gallon jar. Okay, just a second. You're going to put 4 tablespoons of Epsom salts or magnesium sulfate into that jar and mix it up. And like I said, I'll email this to you. You don't have to write it all down because I have it right here. Okay? So, do you? Okay. Okay, and I'll email that to you. Make sure that we. So then what happens is now you have a quart with 4 tablespoons of Epsom salts in it. You're gonna pour that into 4 cups, or you're gonna pour a cup off. Now you stopped eating at 2. At 6 o'clock, you're gonna drink your first cup of that magnesium sulfate water. Okay. Now this is so easy that when my 10-year-old was 5, he did it. Okay, it's not hard. Okay, the hardest part is don't sip it. Okay, don't go because it doesn't taste good. Oh, come on. But it's not bad for you. Okay, so now that was at 6 o'clock. At 8 o'clock, you're going to drink the second cup of magnesium sulfate. Then at 10 o'clock, you're going to take a quarter cup of olive oil and a cup of a cup of grapefruit juice. Okay, again, fresh pressed. Okay, now all of these things have been leading up to you relaxing tissue. So malic acid relaxes tissue. Magnesium sulfate relaxes tissue. And now you just drank olive oil with grapefruit juice, and grapefruit juice has quinine in it, also to relax tissue. Okay? So now, at this point, you take a sliver of ginger, and you lay it beside your bed, and you lay down on your right side. You don't have to stay there, just as long as until you go to sleep. Okay? Once you go to sleep, you can just roll wherever you want. Okay? Now, why do you have a sliver of ginger by your bed? Because what happens is that much oil can be nauseating. And so many times if you start to get nauseated, I just stick that little sliver between my teeth, and I kind of chew on it and suck the juice, and it'll help calm the nausea. It'll only last for maybe 20 minutes at the very most, if it nauseates you at all. Okay?
The amount of oil, does it has to be that amount for
Yes,
everybody?
for
What
everybody.
about the ones who are 7 feet tall or 6 feet tall?
They could
and
probably
one
do
that
more.
is 4 feet.
They could probably do more. My little boy, Aiden, he did the cup of olive oil, or the half. I think it's a quarter cup. I think it's a quarter cup of olive oil.
Okay. And we mix it with something, isn't it?
Oh no, half a cup of cold pressed virgin olive oil, half a cup. Okay. It is a lot, but you know why we want that to do that? What is the liver's response to that much oil? It wants to emulsify all of it. And so what it does is it causes a violent contraction of the gallbladder to expel everything that's in it. Now, you don't feel that violent contraction. That's just what happens. Okay, it doesn't cause any pain or anything like that. Now, the next morning you'll wake up, you'll do the third cup of Epsom salts at 6 o'clock, you'll do the fourth one at 8 o'clock, and then you're done. Now, this is one of the only cleanses that I recommend that day you stay real close to a toilet, because you've taken 4 doses of something that's going to be a laxative, okay? You will have diarrhea.
The Epsom salt that you're speaking of, 1 tablespoon, what does that do to high blood pressure? Is that like table salt?
No. It's magnesium sulfate. It's not like sodium chloride.
Okay. Also, that formula you just gave us will also expel gallstones or kidney stones?
Gallstones, absolutely.
All right.
Because what you're going to see is the very first time that you go to the bathroom after you've done this protocol, you're going to see little green peas, pellets, in your toilet that are floating. The reason they're floating is because they're cholesterol. It's a fat. It floats. Okay? And you'll expel hundreds of them. And what about if you don't have a gallbladder? You know, your liver's what makes them, right? The gallbladder is just a storage place. And so it makes them and stores them. If you don't have a gallbladder, it's still making them, and you'll expel them anyway. Now, they may not be quite as much because you're not storing them, but it is in your liver still. Okay? This isn't a difficult protocol to go through. First 6 days is just drinking some extra apple juice. Okay? So what I do is I start this on Monday. That way the 6th day is on Sabbath. You stop eating at 2 o'clock. It's after potluck. And then you go home and start the whole thing. And then on Sunday, don't plan anything. Okay? Stay home. All right. So the next phase is we want to clean the liver. Okay? And that's actually the paper that I gave you. That's the liver cleanse. It takes 5 days. It's going to be a raw food fast on the very first day. It's going to be 3 days of juicing, fasting, and then a day of raw food on the 5th day. In that time, each day you're going to do a blender drink, and then you're going to do a cup of tea with some detox drops in it, and then you're going to eat the fasting through that. Okay, it's all pretty much outlined. Now listen, I wrote these. There are mistakes sometimes in them. If you have a question, call me. I sent the colon cleanse out to Irene and several other people, and Irene called me, or Verlene called me back, and she said, "Did you mean a teaspoon of this, of the second colon part of the colon cleanse 6 times a day, 5 times a day?" And I said, "No, it should be a tablespoon. It should be a tablespoon, not a teaspoon. It's not correct in the paperwork. It should be 1 tablespoon." So there are problems. So just give me a call if you have any questions. Stage 3 is a prolonged curing of the liver. You've got to be on a good quality diet. You know, you got to stop taking toxins in. So you can't be eating processed foods and things like that. You can't be eating things that have insecticides and pesticides and like that on them. It's got to be a good quality food. Cruciferous vegetables have a curing property to them. You know, if a person has an ulcer, if they have damaged tissue, things like that, cabbage and Brussels sprouts and cauliflower and broccoli are all wonderful for the liver. Herbs that you can take are blessed thistle, milk thistle, dandelion, gentian root, wormwood, black walnut, ginger root, garlic bulb, and sweet fennel. There's many others. When we come down to amino acids, when we have a lot of people do cleanses, one of the biggest problems is they feel ill because they're dumping toxins. And so we want them to do ornithine and arginine because this helps the liver to detoxify no matter what the cleanse that we're doing. We use these two amino acids a lot with parasites because it'll get rid of that nauseated feeling and help the liver to detox. Okay, glutathione and malathion or methionine are both super antioxidants, and they help with tissue repair, and they help with detoxifying the liver. So these are some good amino acids to be taking while you're doing a detox. Now, there's one other thing that Max Gerson recommended in his cancer protocol. And so if we're talking about a liver cleanse at that level, we want the liver to be able to expel as much toxins as possible. And with people who have advanced stage cancer, they might have nausea, they might have pain, things like that. A coffee enema with organic coffee is one of the best ways to do that because the coffee doesn't get into your system the way it does if you drink it. The second thing that it does is when it goes into your body, it stimulates the hemorrhoidal vein, which is directly connected to the liver and causes it to dump. Now, Max Gerson would have people do this as often as every 3 hours. And he had a wonderful results with a lot of his cancer patients. Now, I don't recommend that on a regular basis, but in cases like cancer and like that, it's certainly helpful to detoxify the liver. Okay? Any questions? Yes. Wait for it.
So, especially for some people who find themselves alone, not having other family members, considerations about things that could get off track or go awry, or would be a symptom that would let you know that you need to stop or do something different?
Okay, so if you live alone or you're not sure of normal body functions, things like that, and for instance, in the first flush, you're going to have diarrhea. That's a given. Now, that diarrhea shouldn't last more than that one day. I mean, typically it's over by about noon. So, if it lasted any longer than that, you would want to contact myself or somebody who is knowledgeable about that. The liver cleanse is a 5-day cleanse, and it's probably the most difficult part about it would be the fasting part. Now, this may be important to know if you were a diabetic or something like that, where you're taking a medication, and how that medication would interact. So, those are all issues that should be addressed prior to starting. If you're a diabetic, you want to make sure that you are able to regulate your insulin to what you are consuming, because it can cause a problem. It can cause your blood pressure to bottom out, your blood sugar to bottom out. It could cause some other metabolic problems. So you want to be aware of if you have a metabolic problem or something like that, or you're taking a medication. For instance, in the flush, it's recommended that you take grapefruit juice with the olive oil. Well, if you're taking certain medications, that can increase the effectiveness of that medication, and it could actually be more than what you really want to be taking. So there are issues that need to be addressed if you're either on a special diet, or you are on medication, or you are taking if you have a problem that should be addressed before you start this. Okay?
You say that all cancer, it could be cancer, the lung or breast or anywhere start out in the liver?
Yes.
My both parents have liver cancer. They didn't have cancer anywhere else.
Okay, but here's the reason it starts in the liver. It's not that the liver actually had cancer. It's that the liver stops functioning the way it's supposed to, and then it puts toxins in other parts of the body. And when you have a toxin in another part of the body, that can cause a weakness that can cause cancer to grow in that place, regardless of whether it's breast or colon or brain or what have you. Okay? You don't brew cancer in your liver and then it sends it someplace else. Your liver stops functioning the way it's supposed to, and then it puts toxins somewhere else. And that toxins weaken the body and allows cancer to grow in that specific location. Okay? So it's not that it all starts in the liver, because the liver, if the liver was operating the way it's supposed to, it never would have put toxins in a certain location where you might have a weakness. Okay?
I
Yes.
was wondering how often should this be done, once or twice a year?
Depending on the individual, I have treated some hepatitis B and C patients, and they do it about 4 times a year. Now, that they have a chronic illness, and so it's a little bit more for them. A person who is just looking after their health should do it, maybe once or twice a year, and that would probably be sufficient.
The other question is Crohn's disease. I've heard a lot of that,
Okay?
where a person is just really just down out, weak, and all of that.
Yes.
So that would that be one of the things they could do? What some say it's incurable. I'm just wondering.
Well, incurable is a very harsh word. I don't necessarily go with incurable, but with Crohn's disease, Crohn's has an autoimmune and an allergic reaction component. Okay, most people who have Crohn's are they're allergic to gluten or some aspect of food like that, and so it is causing an autoimmune response in their lower colon, and it comes in different levels. So if a person has that illness, would a liver cleanse be beneficial? Absolutely, because the liver is in control of a large portion of the immune system. It also regulates the hormones and all that. And so, in addition to some of the other things that they may do, like cut out gluten or reduce their inflammatory response, I would definitely cleanse the liver in order to get the best results from whatever other protocol they're doing.
Okay.
Okay? Anybody else? Okay. All right. Let's go ahead and have a closing prayer. Our loving Father, thank you so much for your intelligent design of our wonderful body. Father, we know that it was incredibly thought through by you to make our liver and our brains, and we are indeed fearfully and wonderfully made. We thank you for that, and we ask that you would continue to watch over us on this Sabbath day. In the name of Jesus Christ, amen. If you want me to send you the gallbladder flush or any other cleanse, just give me your email and I will send it to you.